The video you guys are about to watch is what I put together when I was getting my nose filler done by the beautiful nurse Tania. It was going to be just like a small little vlog video, but then I thought, why not make it a bit longer and answer some questions you guys may have about nose filler, and also Tania will be answering some questions. So sorry if this video seems like it's a bit all over the place. It was just supposed to be a small vlog. But yeah, I hope you guys enjoy it. It's just literally me getting some needles in my face, which I'm sure we all love watching. And at the end of this video, I will be answering some questions you guys asked me about nose filler on my Instagram a while back. And Tania will also be answering some of your questions. So stay tuned till the end, and yeah, hope you enjoy it. Long story short, I'm going to get fillers on my nose. So this will be really interesting. I'm really excited. I've always wanted a nose job, but I thought before I go get a nose job, I just want to get fillers on my nose to see what it looks like. But yeah, her name is Tania and I'm so excited. I'm going to film the whole thing so you guys will see from start to finish. But yeah, let's go. We've just got the numbing cream on. Do you want to say hello? Hi. As you can see, it's like really juicy. I just can't wait to get my nose fixed. God, it looks disgusting from the side. All right.
It's already quite lifted nicely, but you want a little bit more of a lift and straightening at the bridge.
Yeah, get rid of that little bit. Get rid of it, God damn it.
Right, towards me. You've got a nostril on this side, on your left nostril, a fraction higher. Who cares? But
Let's fix it.
Yeah, and then facing that way as well. And again, let's get you that. Close down. And I'll get you at 45 as well. Is that alright?
Yeah. Seriously, I'm not feeling anything. I'm not in any pain. I can't even feel this, just so you know. Like, I'm full stress and it was going to be on my nose and I was going to be in pain.
No pain?
No. I'm actually so crazy. Like, I can't believe I can't feel the pain. Like, I know the numbing cream works, but sometimes you can still feel the needle going in. But I can't.
Magic needles.
No, it's the way you are. You're really good. Oh. Yeah, I can see a difference.
I'll know once I sit you up, because
Yeah.
I like to do it in two sort of
Yeah.
two ways. So I'll get you. Actually, I want you to sit up. Have a quick walk. Sit up a little bit. Okay, so I still haven't done
I
that.
feel gorgeous.
Just admire my
No, it's okay. What is happening?
Turning up here, because we need to have a nice flow that goes from the forehead and sort of like a ski slope, goes straight into the nose.
Yeah.
Without making it too unnatural.
Yeah,
Otherwise
yeah.
it can look a little bit fake.
Yeah.
So this way it's still looking natural. So I've done a slight tip, not too much. I want you to get used to it. I don't want to make any drastic changes today because I want you to get used to
Okay, that's a good idea.
how it feels. And also we'll go through sort of what to look for, any changes. Noses are a really high risk area, so unlike other areas of the face, I teach my patients to look out for certain things when they go home.
That's really good too.
So
I feel really well educated here as soon as I've come in too.
So all patients have to send me pictures when they get home. You have to, or I'll stalk you. You don't have a choice because it's really important that we pick up any changes. If there are any changes, we pick it up soon.
I just like when I can see difference when I smile.
I haven't finished yet. So we're going to use some anti-wrinkle injections as well. Erin flares a little bit when she smiles and it does bother her. And she also has a slight downwards slope when she smiles on the side. We're not, I've mentioned in this morning's post, we're not still creatures, we're moving creatures, so you see us in animation on the side and it bothers her a little bit, so we're just going to put a little bit of anti-wrinkle injections in there as well.
Let's do it.
So see the V bit? We call it, that's a columella.
Okay.
So see how it's hanging a little bit lower? I'm having a look in the next picture.
Yeah, it's
You can see
even.
it's a little bit higher there.
Yeah.
So the nostrils a bit more even.
because that was like up like that.
And I always tell patients, you know that it's lifted because you'll go home and you'll be like, damn you, Tania, I see nose hairs.
Yeah.
So-
It's been about 2 weeks now since I last saw Tania for my nose injections. I've come back today because we're just going to add a little bit more filler on my nose. Tania didn't want to do everything at once, so it didn't shock me or scare me, and you know, it just limits the risks for many things when you're getting nose injections, like nose fillers. I just want to talk about my recovery from 2 weeks ago. I had no bruising. I had a little bit of redness for probably like a day or two, and that's about it. No one could tell if I had injections anywhere until you watched this video, which was really good, because normally, like say you get lip fillers, obviously your lips swell really bad or you have bruises, but my nose didn't bruise at all. Like at all. I was really surprised that I wasn't in any pain or anything, like it wasn't tender to touch. Well, I did bump it once and that did hurt a little bit, but like when you genuinely just touch your nose after the injections, I felt nothing. What else? So I'm gonna go in now and she's just gonna add a little bit of here, there and everywhere. Of course I'm gonna video record it all, so once I put this video together, I hope you guys get a better understanding or more knowledge on nose fillers and how to go about it. And I cannot recommend Tania any more than what I'm doing right now. She is just incredible. The way she speaks to you about everything, she's so well educated about what she should be doing. She'll tell you if she doesn't think you need it. I really can't feel anything. I'm like watching me like any minute now. You could use this numbing cream for tattoos, I reckon.
Probably.
Yeah.
Have a little look there for me. So I've got to clean that for you.
Oh yeah. Oh, that's real different. Like good difference.
Now, is that, obviously we've lifted it.
Yeah.
So try to get it as straight as I can there for you.
Yeah, no. It's so different.
Lifted it. Now with the tip, we could continue to go higher. I think just hold. It's up to you.
No, just leave it, yeah. Whatever you recommend. If you didn't say stop, I would just go out with the biggest tip ever.
No.
So one of the main questions I got asked about nose filler was, did it hurt? No. I don't know if you saw in that video, but I'm not even kidding you. Whatever numbing cream she has that's from outer space, I could not feel anything. Like you can feel a bit of a needle going into your skin, but you don't feel sore. For all the girls out there that ever get their lips done, I mean, Jesus, that hurts. So I would recommend getting nose filler before lip filler because it didn't hurt at all. I know that there are a lot of dangers from getting nose filler, but at the end of the day, there's dangers in getting anything put in your face, isn't there? So, and Tania was so professional about everything. If I was nervous about something, she made me feel at ease, or she'd recommend not getting something if I was like, no, I want to add more, and she was like, oh, I don't think so. So overall pain, probably a 2 out of 10. And I'm not even kidding you, 2 out of 10, 100%. Apparently the most painful spot is like here, but that didn't hurt at all. Like I was full stressing, I was sweating, and I was like, this is gonna hurt, but it didn't hurt at all. Another question I got asked was, why did you get it done? I think you have a great nose. Thank you. But I don't know, I've just never liked my nose. And if I could get a nose job today, I would. So I thought, why not do something that's not so invasive and just get nose filler and see if I like it. And it turned out I loved it. So I'm not going to get a nose job anymore because nose filler did what I wanted, because I had a little bump here that I wanted to get rid of. And yeah, so that's why I got it done, because I wanted to. Another question was, did I bruise? So no, I did not bruise at all. I had a little bit of redness on my nose, and I thought I was going to bruise a lot because, as you could see in the videos, I was bleeding quite a lot in some of the injections. But no, I didn't bruise at all. It was a little bit tender like the day after, but like when you get your lips done, you're bruised and you're swollen everywhere, where I wasn't swollen at all, wasn't bruised. It was really good. It just makes you want to go back and get more, because you're like, recovery was so easy. And maybe, you know what, maybe it's just the way Tania does it. She's so perfect at what she does. She's so precise. She's just like the queen of nose filler. Like, have you guys checked out her page? I'm going to tag her in everything I do about nose filler. You guys need to check out Tania's page. Like, she's just come from like nose heaven, and she's just here to help everyone and their noses.
I have a bump in my nose, and my local injector is saying don't get it injected as it's too dangerous. Question, and look, it's not a treatment to be taken lightly. So first thing that I like to say is that dermal filler treatment in the face is a medical procedure. I think we often associate it with just beauty, but anywhere in the face that you have dermal filler is a medical procedure, and as with any medical procedure, there are going to be risks. There's no denying it. The arteries on the face, or on the surface of the nose I should say, also communicate with the deep arteries around the eye. So there is a really small chance that the filler can track back and cause blindness. But again, this is not just a risk with nose filler, it's also with forehead and also with the frown area. The risk is really low, just want to let you know that. So it's around 1 in 10,000, but I can understand why so many providers don't do this, because even 1 is too much, and that would be both traumatic for the patient and for the provider. But again, you need to be in the actual artery with such force, such pressure. It needs to be going in that direction. You know, there needs to be a lot of things that happen before that, you know, and we're trained to pick out what, you know, what to look for. You'd be in a lot of pain. You would see mottled appearance. It would be, you wouldn't be able to miss it. So it's very rare. I always say you've got more chance of being hit by lightning or being hit by a car. Many patients love how long nose filler actually lasts in comparison to other areas of the face. You know, next time you come in, we can, you know, lift the tip of the nose. We can place a little bit more in the bridge. We can make it look a little bit thinner from the front. So, you know, there's a few things that we can do that we might not all be able to do on the one go. But once you do it, then it will hold, you know, a good 9 months. And again, we can use anti-wrinkle injections. So another thing to mention is that if you are doing it more than a few times a year, whether with me or with someone else, it doesn't matter. Perhaps it's time to look into something a little bit more permanent. How many times a year can I have nose filler? Again, everyone is a little bit different. There's no right or wrong answer. In my patients, initially, I like to do 2 sittings within the first month, and then say around month 5, we can place a little bit more. No more than 1 mil is ever used in a treatment, because it's an area that has tiny blood vessels and I don't want to be blocking these, so not too much at once. And each time I add a little bit of filler, what I'm essentially doing is creating that longer lasting shape for you. Over time, your body will metabolize the filler, and then you can come in every 6 to 12 months as needed. It tends to hold really well in this area. Unlike lips, which are an area of high movement, the eye area, you know, doesn't have that area of high movement, so it tends to hold really well. High risk and danger. It's really good to clarify these points. So when we're talking about a high risk area, we're normally referring to the first of 2 things, which is what we call a vascular occlusion or vascular compromise. And this is basically when filler blocks a vessel. And out of all the procedures we do, the highest rate of vascular occlusion is actually in the lip area. And this is just because of the sheer amount that we do worldwide. So certain areas they say have higher risk areas than others, but in terms of the amount, it's actually in the lip. We're doing so many worldwide. You've got your superior and inferior labial arteries that run across there. Then in about 1% of us, you've got this other labial artery that runs anterior. Too much scientific information for your ISO brains today, so we'll keep it simple. But vessels everywhere, all over the... And then there's a risk of possibility of scarring, but this can be identified quickly and treated so that it doesn't remain a long-term scar, but we don't shy away from anything. That's why we call it informed consent, because I inform you of everything. And all procedures and all medical procedures have risks. So we talk about all this through the consult. I give you all the information that you need so you can go away and make an informed decision of whether or not that you feel that this is the right procedure for you. Bump on my nose, can nose filler fix that? I always think, why the nose? What is it about noses? We love noses, and the best thing about noses for me is that I often get to treat a physical attribute that is connected to something deeply emotional within the patient when they come in. And I feel that it can help the patient feel more confident. It can often correct some aspect of the nose. So whether you were born with it, maybe you grew more of a hooked nose as you became older. Maybe you had a traumatic incident when you were a younger child. So nose filler is great for straightening out some minor bumps and irregularities. And it can really have a dramatic effect on your side profile, and that's where the biggest difference is. Yes, we can do a little bit to the front, but your side profile, because of the way that light reflects certain parts of the nose and different angles, visually we can make it look smaller in the right nose. So I often say a smaller to medium nose.
That's the video done, guys. Thank you so much for watching. If you have any other questions you would like answered about nose filler, feel free to DM me. I would highly recommend DMing Tania because she is the nose queen. But yeah, thank you guys for watching.